cephalic vein. This vein is near the base. For reason it's called basilic vein. Cephalic, basilic. Both of them ascend in the forearm into the superficial fascia. Basilic vein pierces the superficial, pierces the deep fascia, and is changed to basilic, is changed to axillary vein. Here is basilic, here is axillary vein. Okay? Cephalic vein ascend into the forearm, ascend into the arm, and drain into the axillary vein. Cephalic, basilic. Basilic pierces the fascia and is changed to axillary vein because move toward axilla. Cephalic vein ascend into the forearm. Next, between 10 o'clock to 12 o'clock. Okay? Cephalic vein ascend into the forearm, ascend into the arm, and drain into the basilic vein. Anterior to elbow joint, there is a connection. There is a connection between cephalic and basilic vein. Anterior to elbow joint, there is a connection between cephalic and basilic vein. This connection is called median cubital vein. Okay? In clinic is used very common because for blood sampling or injection, this vein is used. In this figure, behind of the hand, dorsalis plexus, two vein origin, basilic, cephalic. Okay? Basilic penetrates, pierces the deep fascia and is changed to axillary. Cephalic ascend and drain into the axillary. This vein between cephalic and basilic is called median cubital vein. Superficial nerves or cutaneous nerves, because these nerves innervate the skin. Cutaneous nerves. Hand, forearm, arm, and trunk. Okay? Lateral side of the arm. Lateral side of the arm, there is two nerves. Upper part is called upper lateral cutaneous nerve or arm. Lower is called lower lateral cutaneous nerve or arm. Upper lateral cutaneous nerve of arm is a branch of the axillary nerve. Lower lateral is a branch of the radial nerve. Medial side of forearm. Medial side of forearm. Innervated by medial cutaneous nerve of arm. Lateral side of the forearm. Lateral side of the forearm. Innervated by lateral cutaneous nerve of forearm. Is a branch of the musculocutaneous nerve. Musculocutaneous nerve. Medial side of forearm, medial cutaneous nerve of forearm. Forearm. Both of them, medial cutaneous nerve of arm and forearm, are branches of medial cord of brachial plexus. Medial cord of brachial plexus. Brachial plexus. Hand. Okay? Hand. 1/3 lateral finger. 1/3 lateral finger. Thumb, index, middle, and lateral side of ring finger. Thumb, index, middle, and lateral side of ring finger. Innervated by median nerve. Median nerve. 1.5 medially innervated by ulnar nerve. Median nerve and ulnar nerve. Okay? Palmar surface of the hand. Palmar surface. Dorsal surface. Palmar surface. 1.5 laterally median. 3.5 laterally median. 1.5 medially ulnar nerve. In this figure, you can see cephalic and basilic median critical vein. Basilic penetrate deep fascia is changed to axillary. Cephalic drain into the axillary vein at the axillary fossa. Medial critical vein is used for injection and sampling, blood sampling. Okay? Blood sampling. Cutaneous nerve of upper wing anteriorly. This area is innervated by lateral cutaneous nerve of upper lateral cutaneous nerve of arm. Lower lateral cutaneous nerve of arm. Lateral cutaneous nerve of forearm. Medial cutaneous nerve of arm. Medial cutaneous nerve of forearm. Median nerve, ulnar. Posterior. Posterior. This one is named. Okay? Posterior. Midline of posterior surface of the arm. Midline of posterior surface of arm. Midline of posterior surface of forearm. Innervated by posterior cutaneous nerve of arm. Posterior cutaneous nerve of forearm. Both of them are branch of the radial nerve. Radial nerve. Okay? Posterior or dorsal surface of the hand. dorsal surface of the hand innervated by 3.5 laterally by radial nerve, 3.5 laterally radial nerve, 1.5 medially ulnar nerve. Pain transfer by dorsal pectoralis nerve of forearm. Pain transfer by ulnar nerve. Pain transfer by medial pectoralis nerve of forearm. Okay? Pain transfer by lateral pectoralis nerve of forearm. Pain transfer by radial. Okay? This one is Kutangus innervation of the upper limb. Dermatome of the upper limb. What is dermatome? This one is dermatome. I will learn that all of this nerve contain 2 or 3 spinal nerve. For example, lateral pectoralis nerve of the arm is formed by C5 and C6, for example. Median nerve is formed by C5, C6, C7, C8, T1. Okay? But which of them are dominant? Dermatome is meaning a special area of skin, that is innervated mainly by single spinal nerve. This one is formed by C5, C6, C8, T1. Okay, but which of them is dominant? C6. Okay, C6 is dermatome of the tongue. Dermatome of upper limb. Are skin covering the deltoid muscle. Skin covering the deltoid muscle is innervated by C4. Skin in lateral side of the arm and forearm. C5. Thumb. C6. Thumb. C6. This one? C4. C6. Middle fingers. C7. Little finger and medial side of the hand. C8. Medial side of the forearm. T1. Medial side of the arm and axilla. T2. Okay? Beginning by C4 and C2. C4, C5, C6, C7, C8, C1, C2. Okay? This one is very, very important for you. Because, for example, this area of my skin is painless, is senseless, showing which spinal nerve is injured.
T1.
C5. This injury may be produced by disc herniation, which is herniated. Intervertebral disc is herniated, is bulge. C5 exit to C4, C5 vertebral, C5 intervertebral column. So disc, intervertebral disc, C5 is herniated. Pressure on the C5 spinal nerve, and this area is painless. This area is senseless. Okay? dermatome is very, very important for diagnosis of injury. Okay. Superficial fascia is removed. Superficial fascia is removed. Deep fascia is removed. We can see some muscles. These muscles is classified to shoulder-girdle muscle, arm muscle, forearm muscle, hand muscle. Today we study shoulder-girdle muscle. Shoulder-girdle muscle helps to shoulder-girdle bones for connection of upper limb to axial skeleton. Okay? Shoulder-girdle muscle connect upper limb to axial skeleton. Anteriorly, we can see muscles origin from ribs or sternum. Anterior muscles from superficial to deep. You can see this muscle. You can see this muscle. What is this? Pectoris major. Pectoris major. Origin from clavicle, upper 6 costal ribs, upper 6 costal ribs, and sternum. Okay? You can see the sternum, upper 6 costal rib, and clavicle. The muscle change to tendon, and tendon attached to
intertubercular.
Which part of intertubercular? Lateral rib. Lateral border of intertubercular group. Lateral border of intertubercular group. This muscle is innervated by medial and lateral pectoral nerves. This muscle is innervated by medial and lateral pectoral nerves. What's function of this muscle? This muscle is adductor. This muscle is medial rotator. Clavicular head is flexor. Okay? Pectoris major. For numerals of function, you must focus on direction of fibers. Direction of fibers. Origin is fixed. Insertion is movable. Okay? This muscle is shorter than adduction, it's shorter than rotation, it's shorter than flexion. Adduction, medial rotation, and flexion. Pectoris major, the function of pectoris major is flexion, adduction, medial rotation of shoulder joint or arm. Shoulder joint or arm. Deep to it. What? Pectoris major, okay? Sternum, pectoris major, sternum, upper 6 costal rib, clavicle. Okay? It's changed to tendon and instead to lateral rib of intertubercular groove. Function, abduction, medial rotation, flexion. Is innervated by medial and lateral pectoral nerve. When pectoris major is removed, pectoris major is cut and removed, we can see two muscles. One, pectoris minor, and subcutaneous. Pectoris minor origin from ribs. This muscle origin from costal ribs. This muscle origin from ribs. Third, fourth, and fifth ribs. Insert to collateral process. Innervated by medial and lateral pectoral nerve. Innervated by medial and lateral pectoral nerve. Function. You must C. Convectional fibers. Function.
Refraction, protection.
Function. This one. Shoulder depression. Shoulder depression. Curvature process move downward. Shoulder depression. Other function. Origin is anterior, insertion is posterior. Move this movement. This movement is protraction. Depression and protraction. Depression and protraction. Subclavius muscle. Origin from first rib. And insert to clavicle. Okay? Insert to clavicle. Is innervated by subclavian nerve or nerve for subclavius. Subclavian nerve or nerve for subclavius. The function of this muscle is stability of the clavicle. Stability of the clavicle. I want to move flexion, extension, abduction, many muscles attached to clavicle. Okay? The clavicle must be fixed for this function. Which muscle fix the clavicle? Subclavius. Okay? In this figure, you can see pectoralis major, pectoralis minor, and subclavius. Pectoralis minor. Okay. Laterally, you can see this muscle. What is this muscle? Deltoid muscle. The deltoid muscle origin from acromion, okay?
Scapular spines.
You have tissue.
Yeah, it is on the
It's
table.
not on the table. Not on the table. On the table. Serve on the table.
Oh, thank you. Okay. You can see clavicle from superiorly, this one clavicle, okay? Articulate to acromion, acromion continues as a spine or scapula. This figure is from above. Okay. Origin of deltoid muscle is from lateral half of the clavicle, lateral surface of the acromion, inferior border of the spine of scapula. Okay? This one origin of deltoid muscle. Deltoid muscle origin from clavicle, acromion, and lower border of the spine of the scapula. Lower border of the spine of the scapula. This muscle insert to deltoid of the humerus. Deltoid of the humerus. This muscle is innervated by surgical neck is fractured. Axillary nerve. This muscle is innervated by axillary nerve. Function of this muscle. Anterior fibers. Anterior fibers. Flexion. Medial fibers. Abduction. Posterior fibers. Extension. Okay? Flexion, extension, abduction. In addition, this movement. Medial rotation. This movement. Lateral rotation. All movement of the shoulder joint take place by deltoids. Flexion, extension, abduction, medial rotation, lateral rotation. All of them are function of the deltoid muscle. Which function is very important? Abduction. Abduction is very important. Okay. In coronal period, the deltoid muscle is used very, very for
Project.
vaccination. For vaccination. This one. Lower part of the deltoid muscle is safe because all neurovascular structure are above area. Neurovascular structure are above half, upper half. Okay. Posterior muscles. They begin by anterior muscles, lateral muscles, no posterior muscles. When skin is removed, we can see two large muscles. This muscle is trapezius, this one latissimus dorsi. I touch trapezius, latissimus dorsi. Okay? Trapezius muscle, origin from head. Which part of the head? This prominence behind of the head is called external occipital protuberance. External occipital protuberance. Okay? Nuchal ligament. Other name is neck ligament. Nuchal ligament. All spinous process of the thoracic vertebra. Spinous process of thoracic vertebra. T1 to T12 are origin of trapezius. Touch return of the posterior of the neck. Touch. Okay. We cannot touch a spinous process because the spinous process is covered by nuchal ligament. When move down, you can touch a spinous process of C7 vertebra. After it, you can touch the spinous process of all thoracic vertebrae. Okay? Well, this is an original trapezius is external occipital protuberance, nuchal line, and a spinous process of all thoracic vertebrae. These muscles move, these fibers move laterally toward shoulder joint. toward shoulder joint and attach to here. Attach to clavicle, acromion, upper border of the spine. Insert origin of deltoid is insertion of trapezius. Origin of deltoid is insertion of trapezius. Okay. This muscle is innervated by spinal part of accessory nerve or 11 cranial nerve. Okay? Yesterday we learned this muscle and this muscle. Both of them are innervated by 11 cranial nerve. Other name is accessory nerve. Which part of accessory nerve? A spinal part. A spinal part of accessory nerve. Function of this muscle. Function of the trapezius muscle. Upper fibers dysfunction. What is dysfunction? Dysfunction. Extension of the head and neck. Extension of head and neck. Okay? Upper fiber, extension of head and neck. Middle fiber. If this fiber show which function? Retraction of shoulder. Lower fibers help to abduction above 90 degrees. 290 degree deltoid. After it, by trapezius. This one is my scapula. Okay. Pelvis, lower fibers, insert to spine of the scapula. Okay. Abduction above 90 degrees. This function. Scapula. Rotate. Patellar cavity move upward. Arm move up. Okay. Function of the trapezius. Upper fibers. Extension of the head and neck. Middle fibers. Retraction. Lower fibers. Abduction. Above 90 degrees. Latissimus dorsi. Origin from hip. Spinous process of the lumbar vertebra. Spinous process of lumbar vertebra. Lower 4 ribs. Inferior angle of the scapula. That is towards the origin from hip. Spinous process of lumbar vertebra, lower 4 ribs, and inferior angle of the scapula. The muscle is changed to tendon, and tendon move anteriorly. And insert through of the intertubercular groove. groove of the intervertebral groove. From back, moving to anterior part and insert the floor of the bicipital groove or intervertebral. This muscle is innervated by thoracodorsal nerve. Thoracodorsal nerve. The function of this muscle is this one. What is this? Swimming, okay? Swimming. In swimming, we need extension, muscle fiber, extension, medial rotation, and adduction. Nobody, no swimming. Okay, this one is false. Swimming, extension, adduction, medial rotation. This one function of latissimus dorsi. The latissimus dorsi extend, adduct, and medial rotate the shoulder joint or arm. Shoulder joint or arm. Okay? When I remove the trapezius and latissimus dorsi, I remove trapezius and latissimus dorsi, we can see three muscles connect vertebral column to medial border of the scapula. Connect vertebral column to medial border of the scapula. These muscles are this one is the scapular spine, okay? Vertebral column, okay? This muscle, and this one. What is muscles? Levator, scapula, rhomboid, minor, rhomboid, major. Okay? In this figure, you can see. In this figure, you can see this muscle. Okay? Levator scapula, origin from upper cervical vertebra. Upper cervical vertebra. You don't need exactly which vertebra. Upper cervical vertebra. Or C1 to C4 vertebra. Descends and insert into the, what is this?
Medial border.
Superior border of the scapula. Superior border of the scapula. Rhomboid minor, origin from lower cervical vertebra. Lower cervical vertebra. And insert to the scapula at the level of the spine. At the level of the spine, root of the spine. Rhomboid major, origin from upper thoracic vertebra. Upper thoracic vertebra. And insert to the medial border of the scapula. Below the spine of the scapula. Below the spine of the scapula. All of them innervate by this nerve. This nerve is called dorsal, because this muscle are dorsal and attached to scapula. So this is called dorsal scapular nerve. Dorsal scapular nerve. three muscles are innervated by dorsal scapular nerve. Function of them. Function of the level of the scapula. The name show me elevate scapula. Elevate scapula. Okay? Rhomboid minor and rhomboid major. When muscle is contract, retraction. Retraction of the shoulder. Level the scapula, elevate shoulder, elevate scapula. Rhomboid minor and major, retract shoulder. Okay? This one is trapezius. This one is trapezius dorsi. This one is medial border of the scapula. Medial border of the scapula. Okay? When you touch inferior angular scapula, this one is medial border. Okay? Inferior angular scapula. Medial to it here is triangle. Triangle is called auscultation triangle. This triangle is bounded medial, is bounded laterally by scapula. Superiorly, trapezius, inferiorly, latissimus dorsi. What's function of this triangle? When I want to descend, movement of the air into the lung is used this triangle. Okay? So, he found or she found inferior angular scapula. Medial to it, we can find auscultation triangle. Auscultation triangle. The auscultation triangle is useful. Auscultation triangle is useful for listening of movement of the air into the lower lobe of the lung. Lower lobe of the lung. Okay. In this figure, we want to study this muscle. This muscle is called serratus anterior. Serratus anterior. The serratus anterior muscle is one. This one. Origin from ribs. Upper 8 ribs. Serratus anterior origin from upper 8 ribs. And insert in this figure you can see origin from upper 8 ribs and move toward the scapula. Insert to this one, serratus anterior origin from ribs. Okay, insert and move toward the scapula and insert to anterior surface of medial border of the scapula. Anterior surface of medial border of the scapula. Anterior surface, okay, medial border of the scapula here. Left, my left, surface anterior, insert into the anterior border of the anterior surface of the medial border of the scapula. This muscle innervated by long thoracic. This muscle is innervated by long thoracic nerve. This muscle is innervated by long thoracic nerve. Serratus anterior innervated by long thoracic. For memorize, serratus anterior innervated by long thoracic. Sound. Serratus anterior innervated by long thoracic. Function of this muscle is one. Function of this muscle is one. What is this?
Protraction.
Protraction of the shoulder or the scapula. Protraction of the shoulder or the scapula. I'm walking here, okay. The call is, yes, stop. The butt is empty. He won't help me. Okay. I push it. This one knee, shoulder protraction. Which muscles contribute to shoulder protraction? Serratus anterior and pectoralis minor. Serratus anterior and pectoralis minor. When long thoracic is cut, serratus anterior is paralyzed. Okay? When long thoracic is cut, serratus anterior is paralyzed, you can see this today. This today. On the right side, serratus anterior is paralyzed. For this reason, the scapula don't move forward. Fix back. This phenomenon is called ringing of scapula or scapula ringing. Okay? Ringing of the scapula or the scapula ringing. In this figure, you can see posterior surface of the scapula. Posterior surface of the scapula. Okay? This one is the spine. This area, supraspinalis. This one, infraspinalis. This muscle, supraspinalis. This muscle, infraspinalis. Supraspinalis muscle origin from supraspinalis fossa. Infraspinalis muscle origin from infraspinalis fossa. Most of them move toward greater to the humerus. Most of them move toward greater tuberosity or greater tubercular humerus. Supraspinatus pass below acromion and insert to apex of the greater tubercle. Supraspinatus move below acromion and insert to apex of the greater tuberosity. Infraspinatus attached to posterior surface of the greater tuberosity. Greater tuberosity. Both of them innervated. Both of them are innervated by suprascapular nerve. Both of them are innervated by suprascapular nerve. Function of the supraspinatus. His function is abduction. First 15 degree supraspinatus. First 15 degree supraspinatus. From 15 to 90, delta. From 90 above, trapezius. Okay. First 15 degree supraspinatus. From 15 to 90, delta. Above 90, trapezius. What's function of the infraspinatus? When these fibers shorter, contracted, you must know this muscle is back of the shoulder joint. Back of the shoulder joint. For this reason, the function of this muscle is
Retraction.
Rotation.
Medial. Lateral.
lateral rotation. Function is lateral rotation. Function of the infraspinatus muscle is lateral rotation. Okay? This muscle is and this one. In this figure, we can see additional muscles, 1 and 2. This muscle, both of them origin from lateral border of the scapula. Both of them origin from lateral border of the scapula. This one is called teres minor. Teres minor. This one, teres major. Both of them origin from lateral border of the scapula. Teres minor pass behind shoulder joint and insert greater to the visit. Insert greater to the visit. Teres minor pass behind shoulder joint and insert to greater to the visit. Teres major origin from the lateral border of the scapula and inferior and inferior angle. Move laterally and anterior. Move laterally and anterior. Tendon of this muscle insert to medial border of the intertubercular groove. Medial border of intertubercular groove. Okay? Medial border of intertubercular groove. This one, teres minor, this one, teres major. Teres minor is innervated by axillary line. Teres minor is innervated by axillary line. Teres major is innervated by lower subscapular nerve. Lower subscapular nerve. Function of them. If you know this muscle, direction of follows of this muscle is like infraspinal muscle. For this muscle is lateral. Teres minor is lateral of the shoulder joint or arm. Teres minor is like infraspinal. Direction of fibers, insertion of muscle, okay, is like infraspinal. For this muscle is lateral of the shoulder joint or arm. Teres major is like latissimus dorsi, because latissimus dorsi origin from back, insert anterior. This one origin from back, insert anterior, intertubercular groove. For this is the function of this muscle is like latissimus dorsi. Function of this muscle is extension, abduction, medial rotation. Extension, abduction, medial rotation. Extension, abduction, medial rotation. We review this one. Shoulder flexion. Which muscles? Pectoralis major, deltoid. Okay. This one. extension, shoulder extension. Which muscle? Posterior fibers of deltoid, latissimus dorsi, teres major. This one, supraspinatus, deltoid, abduction, three muscles involved. Supraspinatus, latissimus. Which muscle? Adduction. This one. Four large muscles involved in adduction and medial rotation. Pectoralis major, teres major, latissimus dorsi, and subscapularis. Okay? Abduction, medial rotation, teres major, pectoralis major, latissimus dorsi, and subscapularis. For this reason, when I am walking in the street, no. Okay? This one is abnormal. Because adductor is larger, medial rotator is larger. My hand is there. Okay? Nobody move. This one is abnormal. Medial rotation, adduction is normal position. Because medial rotator and adductor muscles are large and number are high. Four muscles involved in adduction and medial rotation. But two muscles involve lateral rotation. Which muscles? Infraspinatus and teres minor. Infraspinatus, teres minor are lateral rotator of the shoulder. Okay. In this figure, you can see this muscle is teres minor. This muscle is teres major. This one, infrageminal to infrageminal. This muscle originates from it. This muscle is long head of triceps. You can see two space, quadrangular, triangular. Quadrangular near to humerus, triangular near to scapula. Okay? Border, superior and inferior border of those space are teres minor, teres major. Lateral boundary of triangular area is long head. Medial border of quadrangular is long head. Okay? Three muscles involved the formation of this space, quadrangular, triangular. I ask you, there is circumflex scapular artery. Circumflex scapular artery. What's your thing? This artery is into the triangular or quadrangular? Circumflex scapular artery. Triangular. Because it's near to a scapula. For this is a circumflex scapular artery. Circumflex scapular artery is into the triangular space. I ask you, posterior circumflex humeral artery. Posterior circumflex humeral artery, quadrangular space. And finally, axillary nerve. Triangular or quadrangular? Quadrangular. Axillary nerve. For this reason, this muscle, teres minor is innervated by axillary nerve. Okay? Teres minor is innervated by axillary nerve. The last muscle is subscapularis. The last muscle is subscapularis. Origin from subscapular fossa. Origin from subscapular fossa and insert to lesser. Insert to lesser curiosity. This muscle is innervated by upper and lower subscapular nerve. Upper and lower subscapular nerve. Function of this muscle.
Lateral.
Function of this muscle.
Section.
Medial rotation,
Lateral.
medial rotation and
Protraction.
Lateral.
abduction. Medial rotation and abduction. 4 muscles involved in medial rotation and abduction. Latissimus, dorsi, teres, major, pectoralis, major and subscapularis. Okay?